Welcome everyone to this year's virtual HBU T mini summit. My name is Frank Hood and I am the director of Hepatitis B United, as well as the associate director of policy and partnerships at the Hepatitis B Foundation. And I am thrilled to be one of your moderators for this week's mini summit. On behalf of the Hepatitis B Foundation, the Association of Asian Pacific Community Health Organizations, or you can call them APCHO for short, and the Asian and Pacific Islander American Health Forum and Stop TB USA, we would like to welcome all community members, patients, as well as providers, staff, and administrators of various healthcare and community-based organizations. I'm proud to be serving as one of the steering committee members of the TB of this summit planning committee. And we're really excited to bring you this programming today. For the last 10 years, Hep B United has held a summit to bring people together for education, coordination, advocacy, and really just camaraderie. And we're excited to be hosting again this year and very much looking forward to returning to an in-person summit sometime in 2023. This year and last, Hep B United has partnered with the TB Elimination Alliance to put on this summit as a way to highlight the intersection of TB and Hep B, and to help our TB Elimination Alliance partners grow into a strong coalition the way that Hep B United has over the years. This year's summit is taking place over 3 half days, today through Thursday, as a way to break up the programming and really allow more folks the opportunity to join. We're hosting this summit on Zoom meetings, and we're really encouraging everyone to engage with the speakers and other members. We're hoping to make full use of webcams, chat boxes, and other features that meetings has to offer. And so as such, we ask that everyone have their name in the video box, maybe put your organization and your preferred pronouns. During presentations, we're gonna have you muted or ask that you be muted just to keep down on the background noise. I think we've all learned this the hard way at some point over the year, over the last couple of years in this virtual era, but the chat box will always be open. Should at any point during the summit you run into any problems, please take a look into your participants list for those that have the Ask Me in front of their names. Right now you might see me, Chibo, Evangeline, and Shreya. Just go and directly reach out to them via chat if you have issues with technical things or just questions about the summit in general. They can get you links to the agenda and answer other sort of questions. There's just someone was off mute. We heard the vibrate there. No worries. To cut down on some of those potential technical issues, some of these presentations have been pre-recorded. However, every presenter should be available during their session this week for a live Q&A. In order to keep this summit as beneficial to the community as it can be, we ask for your help to after your attendance to please fill out our evaluation form. Your answers can be submitted anonymously, and we really do rely on them as a jumping off point for future years' sessions. So I would be supremely remiss if I did not say a huge thank you and shout out to all the members of our steering committee who helped us pick topics, identify speakers, and frame conversations. These folks met numerous times to bring everything together that you've seen over the next few days. And many of these individuals you'll actually see speak as presenters or moderators. And so just know that this was really the crew that put their heart and soul into building this out. Additionally, let me move back a slide. Additionally, each day of the theme is going to consist of a different theme that the workshop panels and breakouts for that day will coincide with in some way. And here to introduce each of these 3 days themes are the leaders of the organization that convene Hep B United and the TB Elimination Alliance. So first off is Juliet Choi. She's the president and CEO of the Asian Pacific Islander American Health Forum, which is a national justice organization that influences policy, mobilizes communities, and strengthens programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. She's an accomplished cross-sector leader and coalition builder who specializes in change management, system reform, and stakeholder relations, especially in the areas of immigration, civil rights, healthcare, and disaster relief, areas that very much impact our communities. As a senior executive in the Obama administration, she served as the former chief of staff and senior advisor to 2 federal agencies, the Citizen and Immigration Services at the Department of Homeland Security, and for the Office for Civil Rights at the U.S. Department of Health and Human Services. Prior to her political appointment, she led disaster relief operations and strategic partnerships at the American Red Cross. And as a certified mediator, she received her JD from University of Maryland and her BA in Econ from the University of Virginia. So without further ado, I bring you Juliet's welcome.
Welcome, everyone, and a special acknowledgement and congratulations to our organizers, Hep B United and the TB Elimination Alliance. And also a special recognition and congratulations to our terrific leaders and friends, Jeff Caballero of APCHO and Sherry Cohen of the Hep B Foundation. I'm so pleased to introduce the theme for day 1 of our convening, access to the people. The communities we serve, as we all know, are at the core of what we do. Asian Americans, Native Hawaiians, and Pacific Islanders are underrepresented and underserved. And when we advocate, we know, but we need to help other people understand, they must understand, that our communities are not a monolith. We need to educate more and more the importance of increased screenings, testings, and also we need to come together, all of our communities, so that we can continue to strive for health equity. Let's continue to celebrate the wins and how far we've come, and also celebrate the opportunity to convene like this, have these really important conversations. We need to, we must, and I know, like you, I enjoy these discussions. Thank you so much for what you do day in and day out. Now I'm going to pass it off to my really good friend and colleague, Jeff.
Thank you for that, Juliet. So as she said, we're going to pass it next to Jeff. Jeff Caballero is APCHO's executive director and has been with the organization since 1993. Oh, let me put my video back on, sorry. In that capacity, Mr. Caballero has advocated for programs and policies that increase access to high quality, comprehensive community healthcare services that are culturally and linguistically appropriate. Cultural competency is a huge issue with our communities, as many are aware. Currently, Jeff is nationally serving as the founding co-chair of Hep B United, the founding co-chair of the TB Elimination Alliance, and the founding steering committee member of T, as well as the immediate past chair of the American Diabetes Association's Legislative and Regulatory Subcommittee, as well as a founding member of the Protecting Immigrant Families Coalition. To hear about day 2's themes, here is Jeff.
Hello. My name is Jeff Caballero. Hello, my name is Jeff Caballero, and I'm the Executive Director at the Association of Asian Pacific Community Health Organizations, APCHO. It is an honor to welcome you to the second joint virtual summit between Hep B United and the TB Elimination Alliance. I want to thank the founding members and the steering and advisory committees of both Hepatitis B United and the Tuberculosis Elimination Alliance. I offer special thanks to the CDC Division of TB Elimination and the Division of Viral Hepatitis for your commitment to our coalitions and to our communities. It is important that we continue these collaborations, and your support is key to this endeavor. Working together, we can continue to forge community power, amplify our voices, and develop inclusive and sustainable solutions that will help us eliminate hepatitis B and latent TB infections in the United States. I was asked to introduce the theme of the second day of the conference, which is reaching all populations. What we mean by this is that we are 2 years into this epidemic, and it is still very critical for us to recommit to combining our capabilities, our experiences, and our resources to ensure that populations at high risk for hepatitis B and latent TB receive the vital resources and services they need. This coming year, the TB Elimination Alliance will once again be learning from our Hepatitis B United colleagues as T builds on their Asian American and Native Hawaiian Pacific Islander experience and begin to expand to African American and Latinx high-risk communities. Hep B United has successfully conducted a similar expansion years ago, and we believe T will be able to similarly expand our community-centered approaches to other marginalized communities at high risk for latent TB as well. I know you are tired. We are all tired, but that is why we come together each year. We come together to share our passions for this work. As Oprah says, passion is energy, and feel the power that comes from focusing on what excites you. And day two's topic and agenda, we hope, excites you. Day two starts with policy updates, timely information from our national advocacy and CDC partners, followed by a health equity panel providing insights into the meaning of health equity for different people and populations, and then breakouts to engage each of us in dialogue on what equity looks like in the TB and hepatitis B space. Again, I want to thank you for your commitment to this work and this partnership. Have a great day and have a great conference. Hello.
Thank you, Jeff. And to introduce our third day theme, it is my pleasure to introduce my boss, Dr. Sherry Cohen, who is the president of the Hepatitis B Foundation. For the past 22 years, she has planned, implemented, and evaluated community programs and research projects focusing on reducing health disparities and improving health outcomes associated with hepatitis B and liver cancer. She is the co-chair of the National Hep B United Coalition, co-founder and chair of Hep B United Philadelphia, co-founder and chair of CHIPO, the Coalition Against Hepatitis for People of African Origin, co-chair of the Hep Free PA Coalition, and chair of the Sidney Kimmel Cancer Center Community Advisory Board. She's a member of the ICE Hep B Steering Committee, the Hep View Advisory Committee, and is a member of the Hep B Forum for Collaborative Research and the Patient Advisory Group of the American Association for the Study of Liver Diseases. Dr. Cohen is also a professor at the Ruck S. Bloomberg Institute and adjunct faculty for the Geisinger, sorry if I got that wrong, Commonwealth School of Medicine. And to introduce our third day, here is Dr. Cohen.
Welcome to the 2022 Virtual Hep B United and T Mini Summit. We have an exciting agenda of workshops, panel sessions, and discussions around our challenges, opportunities, and successes as we work towards eliminating hepatitis B and tuberculosis in the US. I want to thank the summit organizers for their diligent work putting together an agenda that is innovative and interactive. Here's a big shout out to the teams at APJO, the Health Forum at the Hepatitis B Foundation. I also want to thank the Summit Committee and Steering Committee members for their enthusiastic participation in helping to plan the theme and agenda for this year's summit. And a big thank you to our partners at the CDC Division of Viral Hepatitis and Division of Tuberculosis Elimination for their ongoing dedicated support of both the Hep B United and T coalitions. Finally, thank you to our Hep B United and T coalition partners. You honor us by sharing your experiences and your expertise and ensuring that our coalitions continue to make a difference in the communities we serve. During this year's summit, we will talk about the infectious elephant in the room, COVID-19. For the past 2.5 years, we and our communities have faced significant challenges. Many of us have had our work sidelined to deal with the pandemic emergency. All of us have had to get creative with new strategies to reach community members and ensure that our Hep B and TB elimination work could continue. So now we focus on the future. What comes next? As we move into a world where we live with COVID-19, what strategies have we implemented that could help us in our Hep B and TB elimination efforts? And how can we leverage the infrastructure that has been built since 2020? I look forward to today's workshops and panel sessions and those over the next 2 days as well. And I look forward to hearing about innovative strategies from our partners. This is our third virtual Hep B United Summit and our second joint virtual Hep B United and T Summit. I have enjoyed them and I have learned from them, but I also look forward to 2023 when hopefully once again we will meet in person. Until then, we invite you to enjoy the 2022 virtual Hep B United and T Mini Summit. Thank you.
Thank you, Dr. Cohen. Over the past few days, we've asked attendees to send us what songs they think felt match one of these 3 days' themes and why. So over the breaks over these next 3 days, we'll be playing those songs and providing those reasonings. The song you heard coming in this morning was my choice, Break On Through to the Other Side by The Doors. And I picked it because ensuring access to the people means that we have to break through the barriers preventing access to life-saving screening, vaccination, treatment, and linkage to care. And so with that, we're going to move right into our first session that's going to look at how these diseases impact people directly. And with that, I'm going to turn it over to Wendy, who's going to moderate our lived experiences panel.
Hi, my name is Wendy, and I'll be your moderator for the Lived Experiences panel of Hep B United and TB Elimination Alliance Summit. I'm so glad you could join us this morning or afternoon, depending on where you live. During this session, we'll hear from our storytellers from the hashtag JustB and We Are TB. The panel will share their firsthand experiences as people in treatment and as advocates raising the profile of hepatitis B and TB to break the stigma and increase awareness, advocacy, and support. Then we'll open it up to questions from the audience. Please feel free to input your questions into the chat and we'll field them through the panel. First, a little bit about myself. I was born in Vancouver, BC, and I've lived here all my life, so I'm a true blue Canadian. Vancouver is a beautiful city to explore, and I love discovering new places here. I have also traveled many times to the States and have great memories on my trips there, especially Hawaii. I acquired Hep B at birth from my mother, but did not find out I had it until I was an adult. I knew nothing about hepatitis B, other than it was infectious, so I made no changes to my lifestyle. Then about 10 years later, my mom was diagnosed with liver cancer and died shortly thereafter. It was a wake-up call to take this condition more seriously, so I began to be monitored for progression of liver disease and cancer on a regular basis. I also became involved with the Hepatitis B Foundation as a storyteller in 2018 and have been so amazed at this organization and how it advocates for people living with this disease. I've learned so much about hepatitis B from their social media page and website. They've also given me many opportunities to speak about my experience, as I want to raise awareness of how hepatitis B affects those who have it and hope that one day a cure can be found. As you can see from these slides, a lot of the people in these slides are actually participants for today, and I'm so glad that they could be here. Thank you for listening to my story, and I would like to introduce our panelists. So the first panelist that I will like to introduce is Bright, or Rochelle. Actually, Rochelle or Bright? I'm not sure who was on the screen. So we'll start with Rochelle.
Hey.
Accidentally muted, Rochelle.
Can you hear me?
There you go.
Am I good? Okay, sorry. I'm sorry about the glasses. I've got some eye infections going on, so I'm kind of keeping them covered today. But my name is Rochelle Gator, and I am from Utah, and I'm really happy to be here. I am actually one of the Hep B storytellers from earlier March of this year. I kind of found out about it with an email a couple of years ago before COVID happened. And then they followed up to see if I was still interested. And I was very interested. I'm actually a physician assistant and a retired Air Force 30 years. And had, my story was interesting because I found out about hepatitis B after being, when I joined the military, they did a blood test because I was going to donate blood. So I was adopted from the Philippines at a very young age. I was an orphan and was raised in California, had a lot of medical issues that nobody could ever explain. So 60s, 70s, nobody had a clue what was going on. And again, I didn't find out till I was 18 years old and I had just joined the military. I have had some really good successes being that I was in the military. They took really good care of me, learned a lot about it in my younger ages, had kids that were born that didn't end up having hepatitis. So I was very fortunate. I have been well managed for a long time just because having been in the military, as a vet, they take good care of us. Again, as a physician assistant, my biggest goal is immunization. I cannot stress it enough. I do worry that it just isn't stressed enough. I know we do vaccinate a lot of our children, and for the most part, they are good. But the sad thing is a lot of our adults still don't understand how important it is to be vaccinated. So that's one of the things that I really want to put my focus into. I am trying to get on board with the Utah Hep B Association so that we can promote this in the state of Utah, because we have a very small organization here, and I would really like to be a part of that. Any questions?
Great.
Did I miss
Rochelle,
anything important?
thank you, Rochelle. We'll have the rest of the panel talk about their story, and then we'll address the questions afterwards. So next on board will be Bright.
Hi, everyone. My name is Bright. Last name is Ansah. In Frederick County, Maryland. I do volunteer with Hepatitis B Foundation and HBIDC, which is a Hepatitis B initiative of Washington, D.C. I also happen to be one of the Just Be storytellers. I also co-host and co-produce the Hepatitis B podcast, Be Happy. My journey with hepatitis B actually started back in 2013, and I found out about my diagnosis by accident. It was because of another health issue that I was having. So by 2013, I started having issue with fatigue, serious fatigue, and so it was through testing and stuff like that that in 2014 I kind of find out about my hepatitis B diagnosis, and that's when I kind of learn about my status as someone with hepatitis B. And a few months after my diagnosis, I also found out that actually I wasn't the only one in my family with it, but all four of my other siblings also have it. And so it kind of piqued my interest in doing more research and learning more about hepatitis B. And so my journey has been, I count myself very lucky to find out when I did, because most people with hepatitis B have no idea they even have the virus until it's too late, when nothing can be done to help them. So I always tell people I feel lucky that by accident somehow I found out about this, and I'm able to kind of do what I need to do to stay healthy and stay alive. So I'm very thankful and grateful to be here. Thank you.
Thank you so much, Bright, for sharing your story. And I know you've been very active with the Hepatitis B Foundation, and I'm very grateful that to hear your voice again. And last but certainly not least, I'm looking forward to hearing Maggie's story on her TB.
Hello, hi everybody. So glad to be here. I'm Maggie. I call myself a former TB patient. and actually I'm advocate from New Jersey with a background in economics and finance. So my encounter with TB started back in 2019 when I fell down on my chair, was working in a spreadsheet in my office and did not know what's going on. So I end up in the ER and get isolated. I stay isolated for 2 years. So it has been a journey, not only because of the TB, because also with an ongoing autoimmune disease that I was dealing already, that led me to extend my isolation time for 2 years. So that really, my experience with tuberculosis really made me go deeper in order to know or understand what's going on. And really that enabled me to be involved with the National Tuberculosis Control Association, providing community engagement and treatment to support through an organization where I'm one of the leaders with We Are TB. And doing the advocacy also led me to talk to most of the representatives and also congressmen in my state in order to talk about the different bills toward research and development and tuberculosis. So besides that, really empowering people around the TB and also raise awareness really make me really passionate about that. I'm coming from a country in Africa where we do not really have the privilege to have all the equipment, all the care that we have here in the United States. So I was really privileged, and I would say lucky to be here and to be alive at that time. So my goal is really to make every TB patient really care, love, and listen, and mostly valuable during that crazy season of their life. So I'm really good. I'm really passionate to really raise the awareness wherever and really get that TB out of our lives for good. Thank you.
Thank you so much, Maggie, for sharing your story, because I do not know much about TB, and I really appreciate you being an advocate and presenting what it is that you experience and how much it has impacted you and how much you also want awareness about it. So there are some questions that I would like to ask the panel, and anyone can answer, just unmute yourself. So what was your level of awareness about Hep B or TB before you were diagnosed? Was it difficult to find information? And did you know that you were at risk or that it disproportionately impacted certain populations, including Asian Americans, Native Hawaiians, and Pacific Islanders? Why do you think there is still such low awareness among highly impacted communities in the US and around the world? Obviously, those are a lot of questions. You don't have to answer all of them, but maybe you want to highlight something that strikes you as what you would like to share.
So my level with hepatitis B wasn't that great. I mean, I've heard, before my diagnosis, I've heard about hepatitis B, and I know it was a virus that affects the liver. That was basically all I knew, and I never really took the time to kind of investigate or research and learn more about it, because at that point, I didn't think it impacted me in any way. So I really didn't care much about it until I was diagnosed, and that changed. And when it comes to information, so I found out about my diagnosis in 2014, and there wasn't much information at that point. The only place I could find information based on my research was on Hepatitis B Foundation and then NIH websites. Those were the two greatest resources that I was able to read or learn about hepatitis B, or kind of find information regarding this virus on. I also didn't know ahead of time that being an African or being born in Africa, in a country in Africa, I was prone to getting this virus. I didn't know anything about that, but I kind of learned about this during the research time after my diagnosis. And why there is still low awareness among highly impacted communities. I mean, I think of three things, and one is lack of funding, which is huge in fighting any kind of disease. And in this case, if you are from a country, a developing country, resources are already scarce to begin with, and so there is no resource, and even when there is, it's very, very limited, and so that causes problem. And then in the Western world, where these resources of funding can be available, sometimes in most situations, this funding is also limited. It's not that huge. It's not a lot of money that goes into education and awareness. And sometimes I wonder, here in the US, sometimes I wonder, it's a question I ask myself, whether it is because funding is restricted or funding is limited because of the people that this virus impacts. Because majority in the United States, I think it's estimated that about 80% or more than 80% of United States Hep B cases in US is among immigrants or immigrant population. So I wonder if there's a reason as to why funding is limited when it comes to hepatitis B. The other issue is with, as a lot of people from developing countries or other countries will know, some of these viruses and diseases are kind of looked at as a taboo subject, where conversation about it is not tolerated. It's never mentioned and it's never talked about. And so if hepatitis B is seen as a taboo subject, then it restricts or it limits a conversation about the disease and how to kind of prevent it, or how to help people who are already impacted on how to find solutions and answers to their challenges. And so that's another area. And finally, I think the other issue has to do with lack of appropriate language, educational materials. I mean, information on hepatitis B is very, very limited. I mean, here in the US, it's a little bit better, but if you are from a developing country, it's very, very limited. And so if there is no information and there is no appropriate education materials or educative materials, I think it makes it even more challenging to raise awareness and educate people on this issue. So from my perspective, I think those are three areas that I think are kind of problematic, leading to the low awareness among the impacted communities.
Wow, that was very well said, Bright. And I completely agree with you, having been through this journey for quite a long time as well. I feel like people are scared a lot of times to talk about their condition because they feel like they'll be stigmatized. I worked in healthcare through my career, and it was difficult to tell people that I had hepatitis B. And even though I didn't receive any stigma according to prejudice with it, but I still felt that when a hepatitis B patient came in, there was this fear amongst the staff that they were going to get it. And should we gown up? Should we glove? And I'm like, no, you don't. You don't need to do that. And these were healthcare workers. And I think that it is something that people are afraid to voice because they're afraid they're going to be treated differently. And as a result, because perhaps we're not as vocal as we are, generally people are not as vocal as they could be, that there's not the awareness also of how much it impacts us, which is the great thing about the storytellers, is that we are given a voice and we are allowed to share our story and how it has affected us. Did anyone, Maggie, did you want to talk about this in relation to TB?
Oh yeah, sure. So it's the same struggle, I would say, for the TB. And literally in Africa, that's what I found out back in 2019. So globally in 2019, we have like an estimated population of 2.9 million of people who have TB that were not diagnosed or notified or linked to the TB. In Cameroon, where I'm from, tuberculosis treatment coverage was like estimated to 53%. So most of the people may not be aware of the fact that maybe there's something going on, even to know exactly how to distinguish between the different symptoms. What is the difference between a TB symptom, like maybe with a malaria symptom? So finding and treating people with TB is challenging due to many factors, including non-specific disease presentation, inadequate performance, and also the fact that there is not enough, let's say, equipment, technical tools that they might need in order to help people. So helping people in that area can be quite challenging if they not even have any clue about what is going on. So using social media, maybe digital platform in order to raise more awareness, this is our goal, seriously. So even to have access to TB diagnosis and treatment, this is one of the major barriers that I found out over there, that many people are not even aware of that just because it's so taboo. It's so shameful, I would say, to have tuberculosis in our mind. We grew up that people who have tuberculosis have HIV/AIDS, for example. So to have that type of disease was just challenging for anybody. And even the shunning that TB patients kind of feel themselves, how do you say that, going through during the treatment is just already overwhelming, only because they don't know the different platform that they may have in order to get them through the process. So be aware of what's going on, what is TB, but also the different platform that can support the different TB patient is really critical in order to really win that battle against TB.
I'm well said, Maggie, and thank you so much again for sharing your story, because I really didn't know very much about TB, and I'm learning a little bit more now, being involved in this summit and also from what you have shared. Is there anything you want to add, Rochelle, before we move on to the next question?
So I agree with what Bright was saying, you know, as far as finding information. When I found out, like I said, I was 19 years old, and that was probably 1984-ish, not knowing anything about it, being a little kid, not knowing why I was sick. Nobody could figure it out. I was, you know, treated kind of unfairly by my family because they thought for a long time that I was trying to get attention. Then in the military, when I first initially found out, I was treated poorly. I was treated horribly. Everything was double bagged and double gloved and double everything. And I'd go to a dental appointment. It was embarrassing, just because of the way that they didn't understand it well enough, that they just assumed that that you would give it to everybody passing by. My education through the years has come through being a medical educator. I've been a medical educator and then a physician assistant. So I've learned a lot. Like I said, luckily for me, my treatments came on board pretty quickly. Went through some rounds of interferon, which was a very difficult treatment for several months when I was active duty. And then now they have better medications that make it a lot easier to treat for people. But, you know, through the years working in the medical community or the medical field, it's been surprising to me how many people as adults have not been immunized, don't know anything about it, don't understand anything. And, you know, even with everything that we know about it now and the treatments that are there, the prevention that is there, it's surprising to me that people still don't understand it. And it does become very taboo when, you're like getting in a relationship and people are afraid to talk about it, or, any situation where if you say I have this, god awful disease, people, they do shun you. And I think education is really important, so that people understand that it is preventable and it is treatable. That's pretty much all I'd like to add.
Thank you, Rochelle. Yes, you and I are in the same category. I found out when I was an adult around 19, and that was before the internet. So didn't have access to all that information that we do now, and wasn't really interested because I didn't think that it was a significant disease that I had to take, be more aware of. But now that there's so much more research, but even with that, I find that certain people in the medical community do not understand this. And when I was told that I had a high viral load, my GP at the time said, oh, maybe you should get another vaccination. And I'm like, that's not going to help me. So yes, there's definitely always more awareness that we can raise about both of these conditions. So similar to that vein of thought is another question that we have, which is, what has been your experience in accessing the healthcare services you need in order to manage and or treat your Hep B or TB? What challenges have you faced, such as stigma and discrimination, financial and insurance barriers, cultural and language barriers? And do you have any solutions or ideas to help with the Hep B and TB elimination efforts?
So for me, knowing what you have, understanding your disease, knowing the potential of what it can do to you, I think it's individual. A lot of people may or may not care. I've worked in rural medicine where I've had patients that would come in and they didn't care about getting treated, didn't care about the amount of drugs or alcohol they were doing. And unfortunately, you see, I've seen death because of that. But for me, the treatment was, like I said, as being a military veteran, they are on me every 3 months. So I don't have any problems with the treatment. The medications have worked well for me. I feel very fortunate when I found out at a young enough age, I didn't drink because my liver was important to me. So far, I have had more than adequate treatment, as the medications have been good. I don't have any signs of cancer or anything like that. So I think it is going to be an individual helping people to understand the education. I know I can't speak for the other countries that go through this, but I can only imagine it's a lot of taboo, a lot of getting the diagnosis, understanding their diagnosis, and getting their hands on medication, getting everyone immunized. I know that's going to be a pretty big factor in getting, I think access is going to be a huge issue for a lot of people.
Yes, I think we're talking from a North American perspective in terms of access and treatment, because I believe that we do have a lot more ability to have the frontline medications that are available right now. Certainly in developing countries, as Bright has said, Maggie said, that the situation is very different. And I think about the medication that I went on recently, and I do not have insurance coverage for it. I know everyone talks about Canada as being this great medical mecca, but I know that in the States, they actually get coverage for the drug that I'm on, and I don't. And so I have to pay out of pocket every single month, and it's expensive. So I can't even imagine how someone in a developing country would be able to afford that, because it is so pricey. So even though I have access, great access to treatment, we don't necessarily have I don't have the insurance for it because I'm retired. So I no longer have a plan that covers that. So anyone, Bright or Maggie, would you like to also share your thoughts on this?
Yeah, sure. Back then, when I was diagnosed, I received from my sister, my older sister, who's a physician herself. She was confirming that there were like a shortage of TB medication for the past 6 months in our home country. And it was just like a huge hit for me to just understand and just to be grateful for what we have here. So not only that, I had, as I say, an autoimmune disease that kind of made me to be allergic to so many things. So it made my case a little bit complicated because they found out like 6 months later that I have like a little complication that only happened to 4% of people who have tuberculosis. So it wasn't a really fun place to be. But with the whole healthcare workers, it was easier really to go through that process and try different things. And finally, we got to find something that kind of helped me handle the pain, even though even recently I'm still going through long therapy. So that is one of the blessings that we have here in the state. But there is something that I want to mention is just the mental health issue. I do not have any type of discrimination. That was really cool. But acknowledge the fact that remaining isolated for 2 years wasn't fun at all. So it had a huge toll on my mental state, to be honest, and have like that support system for the healthcare worker, for the TB platform to just help me go through this was really something I needed. But not only me, but also the healthcare worker who really wanted to help me, but they really don't know what's going on with me because my system is just, they call it immunocompromised system. So kind of do whatever it wants. It was so challenging for them. And I get to acknowledge the fact that not only the patient who have to, be taking care of their mental health, but also the healthcare workers going through a lot in a day. And in order to come and give that positivity to you, they need to be okay as well. So that is one of the things I was really intentional while talking to the different congressmen that, yeah, we really need to raise those different bills in research and development, not only to get the shortened regimen, but also to get the proper, really proper way in order to help the healthcare workers to better take care of us. Because if our mental state is not okay or their mental state is not okay, they kind of challenge that to us, and is a quite challenging, especially for long-term patient like me. So it was pretty incredible to just have the health department step over. It was just beautiful things to do. But I also have to acknowledge the fact that with the language barrier, we found that in our support group that there are some people coming from Southeast Asia or Latin America that really do not know how to maybe put in the words how they feel, how they cope with the whole thing. And it was a struggle to always maybe find the appropriate staff or appropriate people to talk to them and let them know that, okay, here is what is going on. You can't take maybe alcohol while taking medication. And it was just so fun to just learn all those things through those different meetings that we have with the different organizations we are working for. So I believe, especially here in the United States, there is a lot of work that is done in order for the patient to have the best experience ever.
Wow, Maggie, that's great. I love how you mentioned some very important points, which is the mental health issues, which I think we don't talk about all the time. We talk more about the physical aspect, but certainly with any of these conditions, there is a huge component of depression and anxiety with it. I mean, I think all of us who have these conditions can relate. Every time you go to get your blood tested or maybe get an ultrasound, you're thinking, oh no, is this the time I'm going to find out I have liver cancer? Or is this the time I'm going to find out that my liver is failing? So there's just a huge part of that in these conditions. And I know that people who have hepatitis B and possibly TB as well often have to be put on medication for depression because it's difficult to go through this. And certainly having a great support group, which was hard to have during the pandemic and when we were all shut in, is also vital to all of us so that we can have someone to lean on. And also what you mentioned about the language, that is so true. I mean, I think that being born here and having, English, I take it for granted that I can communicate to my healthcare provider, but every time I go into an office, I would say more than half of the people come in and aren't able to speak English and need some assistance or a translator. And I certainly felt that too when I was in healthcare, which is, yes, a very stressful place to work, as Rochelle can, I'm sure, attest to. It's not difficult. It's difficult to give to people, especially when you also have a condition and you're supposed to give to people. It's quite challenging, and certainly this last couple of years has been more difficult for healthcare providers. So, Bright, what would you like? Oh, I just wanted to mention, someone asked me about how much medications cost in Canada here. I'm on Femlody, TAF, so it costs about $600 a month Canadian, which is less than American dollars. It might be like 400, but and I have a little bit of coverage through Gilead, through their program. But on the other hand, yes, all my ultrasounds, blood tests, any other tests I have, it's paid through by the medical services plan. So I don't have to worry about that. I do just have to pay for my medication costs. So anyway, Bright, what would you like to share?
Yeah, so when I was diagnosed in 2014, I didn't have insurance. And the only way I accessed healthcare was through a community. We had a community center where they do they have a sliding scale where you pay $40 to see a provider. And during that time, the providers at this facility or this agency were actually retired providers who were just volunteering at that place. And so resources were very limited. And so once I found out about my status with hepatitis B, I think I found out less than a month, I found out the provider I was seeing at that clinic has actually transferred to another state. So I went a whole year. I didn't know what to do. I didn't know who to talk to. It's like there wasn't, I didn't know anything. I felt like I was just told that, okay, you have hepatitis B, and that was all I knew. I didn't know, I didn't have anyone to call or like any medical plan put in place, like, okay, this is the next step, this is what you need to do, or you need to do that. There was nothing like that. So I went a whole year without seeing any provider. And finally in 2015, I was able to qualify for health insurance. And with health insurance, I was able to find a provider in an area who I was seeing. Unfortunately, I saw that provider for close to a year, and it got to a point where I realized the provider just wasn't. She was great, but I just felt like she wasn't proactive when it comes to my health. I mean, for example, if I do labs, I have to call her office like 20 or 30 times just before someone will share, okay, this is your lab results. And this is, so it just got to a point where I was just tired with it. And she wasn't close to me. I had to travel to Sibley Hospital, which is in Washington, DC. I had to drive to a metro station, take the metro, and then take a bus, which is about 2 hours just to get to her office. And then when I get there, it just feels like she just wants to get over with the meeting. And so 10, 15 minutes and it's over. And when I ask questions, the way she handles the questions and the way she talks to me, I just felt like, I just felt unwelcome at the place. So the last visit, I was like, no, I'm not going to be seeing this doctor anymore. So I tried looking for another provider, and luckily I found another provider within the same Hopkins system. And it's what a difference. I mean, it's been great. I've never had any issue with this provider. it's been amazing since I transferred to this new provider. And so because I have insurance, things have been a little bit easier for me. And also because of where I live, because I'm in near Washington, DC, I have easy access to providers, which is not the case to a lot of people in other areas here in the States. I mean, there are some people, they have to travel like 4 or 5 hours just to see a hepatologist. Whereas in my case, I feel fortunate that I don't have to deal with that, you know. And so when it comes to health services, testing and medication, fortunately, because I have insurance, that seems to be covered. And the insurance is a Medicaid through Hopkins, and my provider is at Hopkins. So everything seems to be working pretty well. I haven't had any issues when it comes to hepatitis B related care, but I've had other issues with the insurance when it comes to other health issues, but not Hep B. So that's been my experience with that. And so with that challenge, what do I recommend? I think my recommendation will be, and it all comes back to the issue of funding. You know, to me, I think not everyone have access to these well-established hospitals, but in a community, sometimes there are health clinics and community health organizations that kind of try to bridge the gap between the community and then the bigger healthcare system. And so if there is funding, and I believe there is equipment and there is these resources provided in the community, then patients who need these resources can just go to the community with or without health insurance to access services in the community, instead of having to travel hours away just to get help, you know. And so it all comes back to the funding issue. I think that's still a big issue in the communities that we have, and it's very challenging. And I think to improve that, I don't know, I think maybe we need to do more advocating so funds could go down to the community where this resources is really needed. And I think it makes sense to meet patients where the patients are. So a lot of patients are actually in the community. They live in the rural communities. They are not in the big cities. So we have to go to the rural communities. And we know in the rural communities, there is no big John Hopkins facility setting. In a rural setting, it's just organizations like HBIDC, for instance. They go to the rural communities to do these outreach services. And so having the resources, providing funding to these organizations, I think it will go a long way to helping the patients who really need this care.
Very well said, Bright. Appreciate that. I've heard, because I don't live in the States, but I've heard from many people about how it is very challenging, especially if you don't have insurance, and you certainly highlighted that. But even with insurance, the commute for a couple of hours to see someone, and you're in a big city center, and you're right. The people in the rural communities, I mean, how do they access their care? It's hard to imagine. And as Rochelle said, as she went out there, some of them they probably have other worries. They don't want to think about the fact that they have hepatitis B or TB, and they want to, go on with their life, and it's too difficult to actually get this care, even if it is very much needed. And actually, though, I envy the people in the States, because you have, organizations like Hep B United and the TB Alliance and the Hep B Foundation. We don't have that in Canada. We have the Canadian Liver Foundation, which encompasses all the different liver conditions, so it doesn't necessarily focus on Hep B. So I think that you're going to be very grateful that you actually at least have some communities or some organizations that are addressing your concerns. So there is one last question, but I think we've pretty much answered it, which was, what advice would you give to our audience on how to ensure that we're truly centering people with lived experience in TB and Hep B elimination work? I think we've more or less answered that, in that we just thinks that what Bright said was very true. We need to have more funding, and I know that the Hep B Foundation has gone to the White House and talked to some of the congressmen. I'm not sure what the TB organization has done, and maybe Maggie could share a little bit about that. We have about a few more minutes before we're ending this, because we just want to make sure that we stay on time. And I know that there's another program that we have starting a little bit later after this, but Maggie, maybe you want to share about that.
Yeah, sure. So, I mean, the goal will be to unite forces to support countries in effectively rolling out of TB preventive treatment, because the prevention is more way better and less costly than really the treatment itself. So, ensuring access to TB preventive treatment will not only protect those infected by from becoming ill with tuberculosis, but also cut down on the risk transmission in the community. So it will be saving more lives. So we found out also that there is countries, partner, donors, community should work together in order to overcome the TB main barrier. So advocating strongly and communicating widely using whatever tool we have in order to kind of raise the level of awareness, especially in this area, because TB is curable. Maybe people don't know, but it is really curable. But we need to be proactive on that. So increasing funds allocated towards TB research and development, that is a huge big deal, because after COVID, we see all the funds that were allocated to TB dropped considerably for COVID. And that was not really fair, because in short time, we were able to do so much for COVID. And after more than 100 years, there is little change when we talk about tuberculosis. So those are the things that we do. And also shorter tuberculosis disease treatment regimen. That is one of the things that is kind of like a huge difference that it can make for a patient. It can help patient more easily complete treatment for tuberculosis disease, and it can, cure the patient faster, has the potential to reduce the treatment cost, because we have to say it, most of the costs regarding tuberculosis are a kind of subvention. That it is a huge amount of money that the government put on the side in order to help people get the better care. So also going to improve the patient quality of life, and also increase the completion of therapy, and reduce also the development of drug resistance. So those are the different areas we think that we need to have like our focus on, but also work with the civil society in order to get more awareness. Those are the people who can better help us raise the awareness in the large scale, because those people are in every single platform in life. So those are the different area that I think we should be focusing in order to just have our world free of TB.
Wonderful. Thank you so much, Maggie, for sharing that. So I just want to summarize a little bit of key takeaways that I received. Hopefully other people, I'm sure other people have other ideas too. But one of the things important for Hep B is that there be immunization, more testing done so that we can identify populations that have this who are unaware, so that they can get the proper treatment or monitoring. One big topic that came up over again is lack of funding for hepatitis B and for TB in terms of increasing awareness, education, and treatment. Because it is an expensive endeavor to try to treat these, and I'm glad I don't have to see the cost of what it cost for me to get my regular tests and everything. But for those who have to pay it and don't have insurance, and in a lot of countries where they don't, then it is something that people need, not just in the United States, obviously, but in the developing worlds, where I know maybe the resources are more limited, but still, if they can prevent further costly interventions such as liver transplants and stuff. So I hope that that is something that we can all work towards to getting. And another thing that came up was just the whole stigma and taboo about hepatitis B and TB. And let's not be afraid to speak up. I mean, outside of these storytellers, I know there are many other people that are attending here today that have these conditions, and don't be afraid to speak up. Advocate for yourself. It's research, understand it. I really felt like I could go to my doctor with a much better point of view as to how to take care of myself, because I had researched hepatitis B. I understood the different types of treatments and medications that were there. So I think that, yeah, again, another point that Maggie brought up, which I really agree with, is the mental health issues and the language barriers. And when Bright said that without insurance, it's difficult in the States, even though you have these great, all these resources available, if you can't access it because you don't have insurance, that is very, very limiting. So thank you again, panelists, for sharing your story and contributing to today's sessions. And